You have a young puppy or kitten that presents to you with a diaphyseal humeral or femoral fracture. Now, often at that age, the diaphyseal fractures will be long obliques or maybe a short oblique.
And if in a perfect world, this fracture would be repaired with a pin and cerclage wires. Unfortunately, we don't live in a perfect world, and many times our patients do not actually get the surgical repair that their fracture requires.
Nonetheless, it presents to you, and you neither have the equipment or training to repair, and referral is not an option. You have choices here. You could amputate the limb, which I often get emails sent to me with such radiographs, and I think my only choice here is to amputate. What do you think? My reply back to those is always the same. I would try conservative management first. Usually with these young and small animals, I don't even try to splint or bandage. One, you really can't splint a femur. You could splint a humerus with a spica splint, but often these are little kittens and little puppies, and the spica splints are just bigger than they are. I recommend let's just try crate rest with appropriate pain medications, clearly, in these animals, and repeat the radiographs. If it's a 10, 12, 14-week-old puppy or kitten, I'm going to suggest to repeat the radiographs within 10 to 14 days. If it's a little bit older, still open growth plates, but 5 months of age or so, maybe 2 to 3 weeks later might be a more appropriate time frame, and see how the pet does. Often they will do fine with this kind of management. They will heal with adequate or sometimes even really good function of the limb, depending on how the original fracture looks. Often the adequate healing with these animals, even though there's a malunion, the function of the limb is good because of the pull of the muscles in these animals. Around the femur and around the humerus, there's a lot of muscles, and the way the muscles are placed, the flexors versus the extensors, tend to hold the fracture in a little bit of a stable alignment, firstly, and then secondly, the muscles at least tend to hold the joints in a proper alignment. Now, this doesn't always happen, but when it does happen, even if the bone is a little bit shorter because there was, the pieces are overriding one another, as long as the hip and stifle or shoulder or elbow are properly aligned, that they're both facing forward, the limb will continue to work fine, even though there might be a bit of a malunion or a bit of a shortened bone there because of that. It is worth doing. It is worth trying conservative management in these young animals. You can always amputate if you find that no way, they're never going to use the limb again, this is never going to work. It's worth trying.
Now, just to be clear, I'm not saying that conservative management should be the primary repair choice or the first choice to repair these fractures. If primary repair, surgical repair, is not available, I would choose conservative management over amputation. The key components are that the patient is very young and therefore will heal very quickly, and that the fracture is a diaphyseal, humeral, or femoral fracture. Treat the patient by confining it, manage its pain, and repeat radiographs in about 10 to 14 days.